Is even a drop of alcohol too much when you're pregnant? Joining me is Professor Elizabeth Elliott from the University of Sydney and a paediatrician at the Westmead Children's Hospital. Alcohol guidelines in Australia were updated in 2020. Part of Professor Elliott's recommendation has been that women who are pregnant or planning for a baby should not drink alcohol at all. Is that right, Professor Elliott?
Yes, absolutely. We're trying to get the message across that any amount of alcohol at any time during pregnancy could potentially harm the unborn baby. And the best thing to do is to avoid drinking alcohol at all.
So the reason for this is because there is the fear that women who drink when they are pregnant will end up having children with this thing called fetal alcohol spectrum disorder, or FASD. So from what I understand, FASD shows up physically from birth, or it may not be diagnosed till much later when certain behavioral issues present themselves. What are the signs and symptoms of FASD?
Well, first I should just say for your listeners that when a pregnant woman drinks alcohol, it rapidly crosses the placenta and enters the bloodstream of the baby. And there it can damage the developing organs, including the brain. And if that happens, then that can be manifest in a whole range of different problems in the child. So they might have behavioural problems, they might have learning problems, they may have difficulty with motor skills, they might have difficulty with language and speech developing. And in the more extreme cases, they may actually have some physical features which suggest that there was alcohol exposure during that first part of pregnancy when the organs like the heart and the kidneys are forming. So they might have a hole in the heart or a damage to their kidneys or damage to their eyes or ears. But a really important point, I think, for your listeners is that although those sort of birth defects occur after exposure in that first 12 weeks of pregnancy, the brain continues to rapidly grow throughout the pregnancy. So alcohol at any stage during the pregnancy can damage the brain, and that in turn can cause those problems that I've talked about: learning, development, and behaviour problems.
It's interesting that you mentioned that because, you know, when we talk about learning, behavioral development problems, we don't usually realize that till much later. And so I understand that in 2016, you helped to develop Australia's first tool to diagnose FASD. How exactly is it diagnosed?
Well, it's a difficult condition to diagnose because there is no diagnostic tests. You know, some diseases we can just do a blood test and say, yes, this is what you've got. And you're also right in saying that it can be very difficult to diagnose in a newborn or young child. So in the clinic that I run at the Children's Hospital, we usually see children at about 7, 8, 9 when they're starting to fall behind at school or have significant behavioural problems. And often it's not been recognised before then that they were exposed to alcohol during the pregnancy. So occasionally in babies, we can see a small baby who's perhaps got a small head, who perhaps has some unusual facial features and birth defects, and get a history of alcohol exposure in pregnancy. And we might be able to suspect the diagnosis at that stage. But generally, it's the behavioural and learning problems that show up in primary school age children that make people start to think, could this be the result of alcohol exposure in pregnancy? The diagnostic guidelines were developed in 2016, again with funding from our Australian government, because paediatricians and other doctors told us they didn't know how to diagnose fetal alcohol spectrum disorder. They didn't know where to send children for a diagnosis. And so what we did was look at what's done elsewhere in the world, what we know about the harms from alcohol, and we developed a guideline to help clinicians have a systematic, standard sort of approach. So what we do is, first thing is you need to document alcohol exposure during the pregnancy and, you know, how much alcohol was drunk. And that's easy if it's with a biological mother, but less easy if the child is in foster or adoptive care. The second thing we look for is abnormal facial features and the birth defects that I've talked about, which can result from exposure in that first trimester. And we see some characteristic facial features: small eyes, an indistinct area between the nose and the top lip, and a thin upper lip. And then the third thing we look for, which is really the thing that we see in all children, is quite severe problems with their neurological development, their development. So that might be, as I said, language, IQ, academic achievement, motor skills, behaviours, etc. Attention is a big one, common problem. And then a problem with adaptive function. So how can that child deal with the day-to-day activities of life, social skills, social communication, and self-care, looking after themselves?
So Professor Elliott, the signs and symptoms that you've mentioned about FASD sounds very similar to a child who may have autism or, say, ADHD. How do you tell the difference?
Yes, look, this is a very important question, and it's often very difficult to tell the difference. So quite often children come to our clinic with an alphabet of diagnoses: ASD, ADHD, ODD, etc. And the bottom line is that this is a brain injury caused by alcohol. So it can cause all of those problems of autism spectrum disorder, problems of conduct disorder, problems of attachment disorder, problems with attention and hyperactivity due to the brain injury. And what really all ties it together for us is that these are severe in children with fetal alcohol spectrum disorder. And also we've got that strong history of alcohol exposure during pregnancy.
So they've got the diagnosis. Can they actually be cured?
I suppose the message to mums out there is that if you're worried about your child, you should take them to the GP, and if necessary, they will send you to a physiotherapist or an occupational therapist or a speech therapist to try and work out what the problem is and how they can treat it. And it's really important that that's done very early, even if a diagnosis of fetal alcohol spectrum disorder can't be made at that stage. When we see children, we do a full assessment to identify what are their strengths and what are their needs, so we can put in place the right sort of therapies, because the young child's brain is very adaptable, very malleable. It can be trained and retrained. So the earlier we can identify developmental and learning problems, whatever their cause, and the earlier we can put in place effective treatment, then the better the outcomes will be for that child in childhood and also as an adult.
Thank you so much for your time, Professor Elliott. So remember, if you're pregnant or planning to be pregnant, make sure you avoid drinking alcohol.